Hi guys, it's Narelle Cook from CanineCeuticals, and if you're listening to me right now, there's a really good chance you have a dog. There's also a really good chance that you have a dog with joint issues, and if that's the case, then you absolutely need to join me for this week's Thursday's Thought. This week we're looking at a clinical trial comparing the effectiveness of some really common joint supplements on the market. So this study was published only last year, so nice and recent. So they were looking at glucosamine and chondroitin. This PCSO524 is actually Antinol, but just the pure green lip muscle version. EAB277 is Antinol Plus. And just in case you're not aware, Antinol Rapid had a name change and is now Antinol Plus. Exact same product, just now called Antinol Plus. So that's got the green lip muscle and the krill oil in it. And then they had the prescription carprofen, which is a non-steroidal anti-inflammatory drug. And they were just seeing how effective these ingredients were with dogs with hip osteoarthritis. So it was a well-conducted study because many of you might be really surprised to learn that the evidence behind glucosamine and chondroitin in both the human and the animal space is pretty weak and very mixed. So great that they included them in this trial. In terms of what they were measuring, one of the key measures is what's called peak vertical force. In a nutshell, that's basically just the maximum downward force that a dog would exert in this, like the stand position. So if you think about it, if a dog, is in pain with osteoarthritis in one of its legs, it's going to not want to weight bear as much on that leg. So the peak vertical force would be lower for a dog in pain. And then the less pain a dog is experiencing, you'd expect them to be comfortable to put more downward pressure on that leg, so the peak vertical force value would increase. They also looked at some other orthopedic assessment measures as well. The trial went for 6 weeks, and it's really sad because when they look at the prevalence of joint conditions such as arthritis in dogs, they say that up to 20% in dogs older than 1 year of age and up to 80% in dogs older than 8 years of age. So that's not good. The other thing that's not great is the primary treatment approach for dogs with osteoarthritis are non-steroidal anti-inflammatory drugs. So I've done a whole other Thursday's Thought just on non-steroidals because they are so damaging to our dog's gut linings. They can cause ulceration, bleeding, perforation. There's certain health conditions that are contraindicated to give non-steroidals, if your dog's got kidney disease, for example. So if we jump into the study, so the Antinol and the Antinol Plus dose was equivalent to 1 capsule per 10 kilograms of body weight. And just while I'm looking for the results, it's really important that you do dose your dog according to what's going on with their health. So if you've got a dog that's in pain, particularly, arthritic pain, do follow the guidelines for what's required in terms of whatever supplement you're giving, but particularly with the Antinol Plus. So what they found, so overall, over the 6 weeks, the mean change from baseline in that peak vertical force increased for Antinol, Antinol Plus, and carprofen, but there was very little change, no significant change at least, in the glucosamine and the placebo groups. So they basically concluded that, yes, Antinol, Antinol Plus, carprofen, effective for the treatment of osteoarthritic pain in dogs. But the glucosamine, chondroitin, and placebo, weren't associated with positive treatment effects. I will say, though, further down in the discussion, they highlight that maybe the trial just didn't run for long enough for glucosamine and chondroitin to show a positive benefit for joint pain. We don't know. There are a lot of longer-term studies that do use these compounds that still don't show effectiveness. There are some that do show effectiveness. Like I said, it's really mixed, the evidence around glucosamine and chondroitin. I actually did a podcast on that exact topic. So if you are curious about what the evidence says, please jump onto the CanineCeuticals website under the resource tab, look for the podcast and look for the glucosamine chondroitin podcast. So if you want to see visually what happened across the study, this is the mean change in that peak vertical force value. So if we look at Antinol and Antinol Plus here, they're both running pretty close together. So you can see they both continue to go up throughout the whole duration of the trial period. The carprofen, which is this one here, goes up, stabilizes a little bit, but then ends up in a similar spot to Antinol, Antinol Plus. This is the glucosamine chondroitin one. So you can see after 6 weeks, still, much smaller change in that value compared to Antinol Plus and Carprofen. And as we'd expect, the placebo group had pretty much no change at all. So that's really interesting. I don't know how many of you are surprised to learn that the glucosamine chondroitin didn't really do anything. But look, it's no secret. I absolutely love Antinol Plus. All my dogs are on it every day. Because if you think about it, like, it's a high quality omega-3 product and it's anti-inflammatory properties. You can't just localize to one part of the body. So while a lot of the research is around joint health and pain management, which is great, there are so many other conditions that I recommend to customers and clients that they use Antinol Plus for. For example, skin and allergy issues, kidney disease, pancreatitis, even behavioral issues as well. So if you are wondering how Antinol Plus might benefit your dog and you're not sure about what to do, please email us at info@CanineCeuticals.com.au. Happy to help you out there. But other products to think about that complement Antinol Plus really, really well, things like the PEA Plus, which is clinically shown to reduce pain in dogs and cats. So that's a really great one. Super safe as well. The collagen fort is also clinically shown to reduce pain and improve mobility in dogs with osteoarthritis. So the great thing about Antinol Plus, PEA Plus, and collagen fort, none of them have any cautions or contraindications with other prescription medications. So you can give them alongside any meds that your vet may prescribe. So that's really helpful and handy for sure. For more information about any of the products, jump on the website CanineCeuticals.com.au. We've got amazing resources. We've got our quiz now that you can jump online, and if you put in that your dog has joint issues, you'll receive a whole guide on joint health. So definitely jump on the website and do that. But thank you for another week of Thursday's Thoughts, and I'll see you next week.